Hi, my name is Ladine Lammers. I am from the Anatomy 162 class and I'm doing the dissection on the long bone. So here it is. Here is my pork leg bone I'll be dissecting. It is cut longitudinally. This is the superior head of the femur for where the ball and the socket joint would connect to. This is the knee area. This would be the lower leg, the tibia. It's the larger of the two. The lower leg, the lateral, or the other lower leg, the lateral bone, would be the fibula, which I believe was cut off for some reason. So the shaft of the long bone is covered in a periosteum. And I have lost my pick. Okay, shut it off. So on the shaft is covered with the periosteum, which is right there, which is composed of a dense fibrous connective tissue. A typical long bone consists of a shaft or a diaphysis, and the two rounded ends are called the epiphysis. The diaphysis is a strong tube of connective bone, which is right along there. This is where the osteone units would be in the compact bone. The diaphysis is filled with a yellow bone marrow, which is this stuff here. You can see it is soft. It is also stored fat. It is pale yellow in color, but in this specimen it has been bled into and has a slightly pinkish tinge to it. Each epiphysis has an outer compact shell with the cancellous bone inside it, or spongy bone, another name for it. This type of bone provides strength, but the spaces help reduce the bone's weight. It contains marrow. It contains red marrow, which produces three types of blood cells: red, white, and the platelets, also known as erythrocytes, leukocytes, and thrombocytes. The epiphysis disc, which is this thin disc right here that runs through the bone, is a band of cartilage where the bone grows in the legs. In this specimen, it is full grown because you can see that the line is so thin. The medullary cavity is the junction of the compact bone. If you move some of the yellow marrow, you can see there's nutrient blood vessels in there, and they run through the compact bone so that they run through the compact bone so that the product can be sent to and from the medullary cavity. At the ends of the bones there is a hyaline cartilage. When the hyaline cartilage is in a joint, it's called articular cartilage. The lining of this joint capsule is a synovial membrane, which produces a built-in lubricating system as it secretes a slippery synovial fluid into the joint cavity. Interosseous ligaments are found crisscrossing within the joint itself, binding one bone firmly to the other. Joints are further strengthened by overlying muscles and tendons. Now I'm going to scrape along the spongy cancellous bone, and you can hear it's kind of a rough, grainy texture. It would not be appropriate for two bones to join together in a joint. So with the articular cartilage, and the synovial membrane with the synovial fluid lubricating in the joint cavity, this will give a slippery, friction-free motion when it moves. So that is my long bone dissection and my talking about the bone and the joints. So thank you for listening to my long bone dissection.